Have you ever worried that you might not recognize a stroke, not just in yourself, but in someone you love? That fear is more common than most people admit, and today, I want to share something that could quite literally save your life, or the life of someone sitting right next to you. Let me ask you this. Have you ever felt a strange sensation in your body and thought, "It'll pass"? That's what happened to Margaret. Margaret was 79, a retired librarian, sharp, warm, and loved her crossword puzzles. One morning, she noticed a weird tug in her cheek, like it wasn't responding quite right. She brushed it off. "Probably slept funny," she said. But her daughter noticed something wasn't right and drove her to the hospital fast. Because they acted quickly, Margaret made a full recovery. Just 3 months later, she danced at her granddaughter's wedding with the biggest smile I've ever seen. I'm Dr. Elliot Graves. For over 30 years, I've cared for older adults through some of the hardest and most beautiful seasons of life. And in retirement, my mission is simple: to share what I've learned so you can stay independent, strong, and informed. In the next 15 minutes, I'll walk you through 4 early signs of stroke that are often missed or misunderstood, especially by older adults. I'll explain exactly what's happening in the body when these symptoms show up, why time is your best friend in an emergency, and how a single word can help you remember what to do if you or someone you care about shows signs of a stroke. But first, here's what most people don't realize. Strokes don't always strike out of nowhere. Many begin with gentle warning signs, subtle symptoms, little clues the body gives you before something more serious happens. These early clues are your chance to act before the damage becomes permanent. The first sign is sudden numbness or weakness, especially on just one side of the body. This can affect the face, the arm, or the leg. Let me introduce you to Harold. He was 72, a retired high school principal who still loved to tend his rose bushes. One spring afternoon, Harold noticed his right hand felt strange, like it couldn't grip his gardening shears properly. He figured he was just tired from working in the yard. But when he stood up, his right foot dragged ever so slightly. His wife, Elaine, insisted they call their doctor. That one phone call changed everything. What was happening in Harold's body? The part of his brain that controls movement on the right side wasn't getting enough blood. The brain is a hungry organ. It needs a constant flow of blood, carrying oxygen and nutrients. Even a brief interruption can cause nerve cells to misfire or shut down. That's why a stroke might show up as weakness, tingling, or numbness in one area of your body, almost like a flickering light in just one room of your house. Have you ever felt a sudden weakness in your arm or leg and couldn't explain why? That kind of signal is never something to ignore. The second sign is confusion, especially trouble speaking or understanding what others are saying. This one can be subtle or dramatic. Take Barbara, for example. She was 81 and the life of her book club. One afternoon, while chatting with her friends over tea, she started saying strange words. At first, they thought she was joking, but then she couldn't follow their conversation. She looked around, confused, like they were speaking a foreign language. Her friends acted fast and called for help. Barbara was having a stroke, one that affected the language center of her brain. The part of the brain that controls language is usually on the left side. When it's not getting blood, things don't come out right. Your speech may sound slurred. You might use the wrong words. Or you might not be able to understand what's being said to you, even if your hearing is perfectly fine. It's like listening to a radio with static. The signal's there, but the message is all scrambled. Have you ever struggled to find the right word or felt like your brain just couldn't catch up with the conversation? If it happens suddenly and doesn't make sense, it could be more than just a senior moment. Let me pause here for a second. If this has happened to you or someone close to you, even just once, leave a comment and tell me about it. Your story might help someone else recognize the signs. The third early warning sign is sudden vision problems, especially in one eye. This might look like blurry vision, double vision, or even temporary blindness. And here's the tricky part. It can last only a few minutes, then go away. Let me tell you about Leonard. He was 75, a retired accountant who loved reading the morning paper with a cup of black coffee. One day, while scanning the headlines, he suddenly saw what he described as a curtain dropping over his right eye. It only lasted about 10 minutes, so he shrugged it off. 3 days later, he casually mentioned it during a routine checkup with me. I immediately sent him to the emergency room. Tests showed Leonard had experienced a mini-stroke, what we call a TIA, or transient ischemic attack. A mini-stroke is your body's fire alarm. It doesn't cause lasting damage like a full stroke, but it's often the final warning before a much bigger one hits. So why does this happen? Even if your eyes are working just fine, the part of your brain that processes vision needs blood to function. If that part is deprived, even for a short time, your vision can get distorted, not because your eyes are failing, but because the brain can't process what they're seeing. Have you ever had a sudden change in vision that didn't make sense? Even if it was brief, please don't ignore it. It could be your brain's way of saying, pay attention. The fourth warning sign is sudden, severe headache with no known cause. And I don't just mean a normal headache, I mean the kind that stops you in your tracks. Jacqueline, a 68-year-old retired nurse, described it as a thunderclap. It came out of nowhere, waking her from sleep. She knew instantly something was wrong and called for help. That call likely saved her life. This type of headache is often a sign of a hemorrhagic stroke when a blood vessel in the brain bursts. The pressure builds up rapidly, triggering intense pain. It's like a pipe bursting in your house. You can't see it from the outside, but the damage is happening fast, and it needs immediate attention. So let's recap quickly, because repetition is how we remember. 1, sudden numbness or weakness, especially on one side. 2, confusion or difficulty speaking or understanding. 3, sudden trouble seeing in one or both eyes. 4, a severe headache that hits out of the blue. Now, I want you to remember a simple word that could help you save a life. Fast. F is for face. Ask the person to smile. Does one side droop? A is for arms. Ask them to raise both arms. Does one drift down? S is for speech. Ask them to say something simple. Is it slurred or hard to understand? T is for time. If you see any of these signs, call emergency services right away. Time is everything when it comes to stroke. There's a saying we use in medicine, time is brain. That's because every minute a stroke goes untreated, about 2 million brain cells die. But here's the good news. If you act fast, doctors can often stop the stroke in its tracks or even reverse some of the damage. Let me give you an example. Gloria and her husband Walter were finishing dinner when Walter suddenly slurred a word and his face looked uneven. Gloria didn't hesitate. She remembered fast. She called 911 right away. Walter received treatment within the critical window and avoided permanent damage. 2 weeks later, he was back home playing chess with his grandson. Now, let's talk about what not to do if you suspect a stroke, because these are common mistakes that cost people precious time. Do not drive yourself or your loved one to the hospital. Do not wait to see if the symptoms will go away. Do not call your regular doctor's office first. Instead, call emergency services immediately. Why? Because paramedics can begin life-saving treatment on the way to the hospital. They'll also alert the hospital, so a stroke team is ready the moment you arrive. Every minute counts. There are powerful treatments that can dissolve blood clots and restore blood flow to the brain, but they only work if given within a specific time window. Usually within 4.5 hours from when symptoms start. And here's something most people don't know. If you arrive at the hospital too late, you may no longer be eligible for those treatments. The damage becomes permanent. That's why I always say, when in doubt, call it out. Now let's go a step deeper and talk about why strokes happen and what puts you at greater risk, especially as you age. The biggest risk factor for stroke is high blood pressure. Others include diabetes, heart disease, smoking, a past stroke or mini-stroke, and even irregular heart rhythms like atrial fibrillation. But here's the encouraging part. These are manageable. You have more power than you think. Let me introduce you to Samuel. He's 86 now, but 5 years ago, he was living on the edge. His blood pressure was sky high. he skipped medications, ate salty snacks daily, and he refused to exercise. One afternoon, he experienced facial drooping and blurred vision, but it resolved within an hour. It was a warning shot, a mini stroke. That moment changed everything for him. Today, Samuel walks every morning, takes his medication faithfully, and even cooks low-sodium meals for his wife. He hasn't had another incident since. You can lower your stroke risk dramatically by making consistent daily choices. You don't have to be perfect, just aware and committed. And if you already take medication for blood pressure or heart health, make sure you're following the plan. Skipping pills or running out just for a few days can open the door for disaster. Do you have a blood pressure cuff at home? If not, ask your doctor about getting one. Tracking your numbers regularly is one of the simplest and most powerful things you can do to protect your brain. Have you already made some of these changes? Let me know in the comments. It might inspire someone else to do the same. Let's recap the 4 warning signs again. 1. Numbness or weakness on one side. 2. Confusion or trouble with speech. 3. Sudden vision problems. 4. A severe, unexplained headache. And remember the acronym FAST. Face, arms, speech, time. These signs are your early alarm system. They're not just something to know, they're something to act on. And when you do, you're giving yourself or someone else the greatest gift, a chance at full recovery. Before we finish, I want to speak directly to those of you who might hesitate in an emergency. Maybe you felt unsure. Maybe you didn't want to make a fuss. Or maybe you thought, what if it's nothing? Please hear me when I say this. You are never wasting anyone's time by getting help. Emergency doctors and paramedics would rather treat someone who turns out to be fine than miss the chance to save a life. In all my years of practice, I never once regretted sending someone to the hospital who turned out okay. But I've seen what happens when people wait too long, and those are the moments that stay with me. You know your body. You know when something feels off. If your gut says, this isn't normal, trust that voice. You don't need to remember every detail of this video, just remember FAST. Face, arms, speech, time. It's a simple tool, but it has saved thousands of lives. It could save yours. It could save someone you love. And if this video has helped you, even in a small way, would you do one thing for me? Subscribe to this channel. I share practical, proven advice from my 30 years as a geriatric physician. Everything from managing chronic conditions to improving sleep, digestion, brain health, and more. And I'd love to hear your thoughts in the comments. Have you ever experienced any of these stroke symptoms? Do you know someone who has? What happened? Your story might be the one that sticks with another viewer and helps them recognize the signs when it matters most. And before you go, there's something else I want you to know. In my next video, I'm going to talk about 5 foods that are often considered healthy for older adults, but can actually do more harm than good. Some of them might be in your kitchen right now. You won't want to miss that. I'm Dr. Elliot Graves, and I'm grateful you spent this time with me. You deserve to live with clarity, strength, and confidence in your health. And I'll be here every step of the way to help you do just that. Until next time, stay safe, stay informed.